Welcome to this special episode of the Harpreet Singh Show. I'm your host Harpreet Singh from Surrey, British Columbia, Canada. In today's program, this is a collaborative program with Canada India Network Society, and you all remember that on the second Tuesday of every month, we have special guests who come and enlighten you on health issues. Today, we are very proud to have a special guest, Dr. Nadia Khan, who is an international authority on hypertension. And of course, as you know, that Dr. Arun Garg, who represents us from the Canada India Network Society, takes the privilege of introducing our special guest. So I would like to welcome both our guests today. And today our discussion is going to be on a very important issue on high blood pressure causes and prevention. And there is no better authority than Dr. Nadia Khan. So Dr. Garg and Dr. Nadia, welcome to the program.
Nice to be here.
Thank you. Dr. Nadia, welcome.
Thank you so much for having me here.
Thank you for your time. So, Dr. Garg, I would give you this opportunity to please introduce our special guest today.
Thank you. Thank you, Harpreet ji. So nice to be back with you. And tonight is a special privilege to introduce my good friend, a colleague, a hardworking community connector, Dr. Nadia Khan. Dr. Nadia Khan is professor of internal medicine in University of British Columbia. She also head of the Division of General Internal Medicine. She is past president of Hypertension Canada. As a researcher, has published over 150 papers and currently leading the research and education at International Society of Hypertension. So Harpreet ji, we are very privileged to have not only a clinician, a researcher, but a friend of the community who have the privilege of working for the last 10 years.
Wonderful. That's really
Dr.
great.
Khan.
And I was also, reading that she is the head of the Division of General Internal Medicine at UBC, and she's the current lead for research and education at International Society of Hypertension. So what better guest could we have today other than Dr. Nadia Khan, who will be focusing on hypertension, blood pressure, because these are common things as life is getting more and more busy. This is a common thing what we see in everyone virtually. So Dr. Nadia Khan, before I start bombarding you with questions, and then our guests also, our viewers also start asking you questions, if you could tell us a little bit about when we talk about hypertension as such, what do we mean by hypertension?
Thanks very much. So, the thing is that hypertension, as you've noted, is very common around the world. In fact, it's the leading cause of death and disability all throughout the world. Even a bigger predictor of death than smoking or obesity. So it's a really significant issue. And what hypertension is it's long-standing and can be lifelong in most people, a problem where they have too much blood pressure inside of their vessels. So every time the heart pumps, that blood that gets pumped through the heart goes to the blood vessels, and then how much pressure that blood vessel feels with that heart pumping is high blood pressure.
Mm-hmm. Okay. So this thing, what you say, is basically related to our heart. And of course, we talk about, because this program also focuses on integrative approach towards health. And what we are finding is that the mind, body, soul concept, that's becoming more and more prevalent. And Dr. Garg, would you like to take over and talk a little bit about as to, when we talk about keeping our health, heart health healthy, how can integrative health be used towards this approach?
Absolutely. And we are very privileged to have Nadia with us because she and I have talked many times about the role of the person.
Mm-hmm.
So integrative medicine really is part of integrative thinking, how you think about things, how you look at yourself. And our purpose through this program is to bring to our viewers empowerment and education so they take care of their chronic diseases better. And in this context, I'm very also pleased to share with you that the last issue of New England Journal has a lead editorial on mind and body. So I think this concept of integrative health is emerging as the key post-COVID perspective for taking care of chronic diseases.
Mm-hmm.
Blood pressure is the key. Blood pressure is what's known as silent killer. It's one of these things where you have it, but you don't know you have it till you're aware of it. And Dr. Khan will talk about. So, Dr. Khan, I'd like us to lead a little bit, because you were the author of international guidelines, global guidelines for blood pressure. A great honor. I mean, this is guidelines for the whole world, of which you as a Canadian are author. So congratulations. And I was very pleased to see that you included lifestyle interventions as a big part of those recommendations. So share with us, share with our viewers a little bit what those are and how they can help to control their blood pressure.
Great, thank you. And just going back to what you've said about integrative medicine, what we know about high blood pressure is part of high blood pressure is due to your genetics, so your DNA, and maybe it's about a third or half of high blood pressure. But the rest of high blood pressure is actually controlled by things like lifestyle factors. And so it was really important that when we were talking about how to prevent high blood pressure, and even if you have high blood pressure, what can you do other than medications to try to get control of your high blood pressure? It's really working with your different lifestyle factors. And there are many lifestyle factors that can improve your blood pressure if you follow them. And it really depends on what you're interested in. But just to give you an example of some of the lifestyle factors, we know being very physically active is very helpful. So exercising maybe half an hour to an hour, like going for a walk, for example, after dinner, most days of the week helps lower blood pressure. Cutting down your salt helps blood pressure. And even certain foods like beets, taking beets or hibiscus tea or green tea, garlic, for example, can help with managing your blood pressure. And also factors like reducing your stress level, yoga, for example, have also been shown to lower your blood pressure. And keeping your weight down is another key factor for keeping your blood pressure in check.
So as our lifestyle, changes, what we are finding out is everybody's stressed out. There's a race going on, and especially during this pandemic, we find people have been mostly home. So we are also listening and seeing that the number of cases of hypertension have increased during this period also. Could you touch on this aspect, because you have been dealing with the patients during this time also? So what are those major reasons apart from genetics? And I will also like to talk a little bit later about the South Asian population, why in the South Asian population this is more prevalent. But as far as people who have been at home during this pandemic, what have been your observations?
Well, there's a couple of things that are contributing. One is likely the stress levels that people are experiencing. Two is that a lot of people are isolated and at home more, so they're not really getting out and doing their usual physical activity. And a lot of places have shut down that they used to go to. I have a lot of patients that would go to swimming, or they go with their friends to go for a walk, and those things they've stopped doing. So a lot of those kinds of activities have, I think, raised the blood pressure. The other thing is, unfortunately, a lot of people have gained weight over this time period, and it's understandable because there's been so much stress and isolation that people have been gaining weight. So on average, people have gained 15 to 20 pounds during this year, and that can have a significant increase in blood pressure. The other thing is alcohol intake. So some people we've noticed are drinking more alcohol than they would normally. And we know that drinking more than, say, 1.5 drinks if you're a woman, or 2 drinks a day if you're a man, can raise your blood pressure. So those kinds of things are probably all contributing to the high blood pressure.
Okay. Dr. Nadia and Dr. Garg, it's time for a short break. Let's go for a break. We'll be back, and from here onwards, we will continue with the discussion. So please keep on watching the Harpreet Singh Show. And as it is a live program, if you have any questions, you can text me, or you can email me. You can WhatsApp me at 604-603-7555, or you can email me at harpreetsingshow@gmail.com. So we'll be shortly back with our experts.
ਜੇ ਕਿਸੇ ਬਿਜ਼ਨਸਮੈਨ ਨੂੰ ਕੋਈ ਪਿਆਰ ਕਰਦਾ ਹੈ ਤਾਂ ਕੀ ਵਜ੍ਹਾ ਹੋ ਸਕਦੀ ਹੈ? ਸੁਖੀਬਾਟ ਮੋਟਰਸ ਦੇ ਓਨਰ ਸੁਖੀਬਾਟ ਨੂੰ ਵੇਖ ਕੇ ਇਹ ਗੱਲ ਸਮਝ ਆ ਜਾਂਦੀ ਹੈ। ਇੰਟੈਲੀਜੈਂਸ ਦਾ ਉਦਾਹਰਨ ਇਹ ਹੈ ਕਿ ਕਾਰ ਸੈਗਮੈਂਟ ਤੋਂ ਵੱਖ ਸੁਖੀਬਾਟ ਮੋਟਰਸ ਲੈ ਕੇ ਆਏ ਨੇ ਸਰੀ ਦਾ ਪਹਿਲਾ ਟਰੱਕ ਸੈਂਟਰ, ਜਿੱਥੇ ਤੁਹਾਡੇ ਲੋੜ ਦੇ ਹਿਸਾਬ ਨਾਲ ਤੁਹਾਨੂੰ ਲੋੜੀਂਦੇ ਟਰੱਕਸ ਬਾਰੇ ਗਾਈਡੈਂਸ ਦਿੱਤੀ ਜਾਂਦੀ ਹੈ। ਸਪੇਸ ਮੋਡੀਫਿਕੇਸ਼ਨ ਤੇ ਫਿਊਲ ਐਫੀਸ਼ੀਐਂਸੀ ਸਭ ਨੂੰ ਧਿਆਨ ਵਿੱਚ ਰੱਖਿਆ ਜਾਂਦਾ ਹੈ। ਸੁਖੀਬਾਟ ਟਰੱਕ ਸੈਂਟਰ ਇਹਨਾਂ ਟਰੱਕਾਂ ਨਾਲ ਹੀ ਹੈ ਟੌਰ।
ਕੀ ਤੁਸੀਂ ਸਰੀ, ਡੈਲਟਾ, ਰਿਚਮੰਡ, ਐਬਸਫੋਰਡ ਜਾਂ ਵੈਂਕੂਵਰ ਵਿੱਚ ਨਵਾਂ ਘਰ ਬਣਾਉਣ ਬਾਰੇ ਸੋਚ ਰਹੇ ਹੋ ਜਾਂ ਫਿਰ ਪੁਰਾਣੇ ਘਰ ਨੂੰ ਰੈਨੋਵੇਟ ਕਰਨਾ ਚਾਹੁੰਦੇ ਹੋ? ਤੁਹਾਨੂੰ ਲੋੜ ਹੈ ਇੱਕ ਤਜਰਬੇਕਾਰ ਬਿਲਡਰ, ਇੱਕ ਕ੍ਰੀਏਟਿਵ ਇੰਟੀਰੀਅਰ ਡਿਜ਼ਾਈਨਰ ਦੀ ਜੋ ਤੁਹਾਨੂੰ ਸਹੀ ਤਰ੍ਹਾਂ ਗਾਈਡ ਕਰ ਸਕਣ ਤੇ ਤੁਹਾਡੇ ਸੁਪਨੇ ਦੇ ਘਰ ਨੂੰ ਉਸਾਰ ਸਕਣ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ ਹਰਪ੍ਰੀਤ ਜਾਂ ਸੰਦੀਪ 6048259295 ਉੱਤੇ।
ਕੁਦਰਤ ਦੇ ਸੌਮਿਆਂ ਦੀ ਵਰਤੋਂ ਆਯੁਰਵੇਦਾ ਰਾਹੀਂ 5000 ਸਾਲਾਂ ਤੋਂ ਚੱਲਦੀ ਆ ਰਹੀ ਹੈ ਤੇ ਹੁਣ ਕੈਨੇਡਾ ਵਿੱਚ ਹੀ ਬਣਾਏ ਗਏ ਹੈਲਥ ਕੈਨੇਡਾ ਵੱਲੋਂ ਅਪਰੂਵਡ 100% ਸ਼ੁੱਧ ਆਯੁਰਵੈਦਿਕ ਡਾਇਟਰੀ ਸਪਲੀਮੈਂਟਸ ਦਾ ਲਾਭ ਲੈ ਸਕਦੇ ਹੋ। ਸਟ੍ਰੈਸ, ਐਂਗਜ਼ਾਇਟੀ, ਇਨਸੋਮਨੀਆ, ਬਲੱਡ ਸ਼ੂਗਰ, ਕਿਡਨੀ, ਬਲੈਡਰ, ਹਾਜ਼ਮਾ, ਆਈਸਾਈਟ ਜਾਂ ਕਿਸੇ ਵੀ ਕਿਸਮ ਦੀ ਬਿਮਾਰੀ ਦਾ ਆਰਗੈਨਿਕ ਇਲਾਜ, ਜੋੜਾਂ ਦੀਆਂ ਦਰਦਾਂ ਤੇ ਸਰੀਰਕ ਮਸਾਜ ਲਈ ਕਈ ਕਿਸਮ ਦੇ ਆਯੁਰਵੈਦਿਕ ਤੇਲ ਵੀ ਉਪਲਬਧ ਹਨ। ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਲਈ ਕਾਲ 604 628 2003।
Once again, welcome back to the program. We have our special guests today, Dr. Nadia Khan and Dr. Arun Garg. And before we get them back, just like to inform you about our sponsor for today's program. This program is being brought to you with the support of Agnihotri Immigration Consulting. If you are wanting to know about temporary status, PR, you are new to Canada, you are an international student, want to know about citizenship, you want to hire foreign workers, express entries, or you want to sponsor parents or grandparents, you can depend upon the advice of Neera Agnihotri, who has been working as a certified immigration consultant since 2006. For honest and reliable information, you can call her at 604-597-2284. Her address is 12788 76 A Avenue, Surrey, and you can again write on the number 604-597-2284. Our next sponsor is AMC Insurance. If you're looking for home, auto, travel, business, life, or recreational insurance, they have 9 branches in the Lower Mainland to serve you. They're open 7 days a week from 8:30 a.m. onwards till 9 p.m. Call 604-507-6666. Let's get back our guests and continue with our discussion. And once again, welcome back both of our esteemed guests. Dr. Garg, as Dr. Nadia was mentioning, especially during this COVID, we have seen an increase, and she mentioned the reasons also. And during all our programs, we focus on this particular aspect, on the 5 W's, what you talk about. Because as we are mostly sitting at home and still there is uncertainty despite the vaccine being out, people are concerned, there is stress, and sitting at home, munching all around, the sedentary lifestyle has increased more. On this aspect, what would you like to recommend once again?
Yeah, I think in terms of self-realization, how you think who you are plays such an important role in general health. And in COVID, the notion of prayers, the meditation, the mental peace becomes very important. Camaraderie, philanthropy becomes very important. But I think from a practical point of view, I would say diet still is the key for blood pressure. And as Dr. Khan mentioned, salt plays the biggest role. So I would think today's message from my perspective is salt becomes the biggest issue as far as controlling the blood pressure is concerned. So watch your salt, And I think Dr. Khan is the expert on it, and it would be nice to hear from her what her view on salt is. I think it's very hard to control salt. Now, you related to COVID, and I think we'll be remiss if we do not remind our listeners that we are all in it together. We are with you. We realize how difficult it is, but please do your best, whatever you can. And do not give up on prevention. Do not give up on protection. And I know it's very hard many times, and everyone has that realization. Right. But I think we all have to stay together and see the end of it.
Absolutely.
And I think that's what this program is all about.
Right. So Dr. Khan, when we talk about salt, especially the intake of salt, the kind of food that we have started eating, the processed foods and everything else, please elaborate on this and explain to us that why we should be cautioned about this particular thing.
Okay. So that's a great question. So we know that high amounts of salt will raise your blood pressure. It's a very well-known fact. And most of the salt that we consume comes from purchased foods. So you'd be surprised if you look at food labels what has salt in it. And the reason there's so much salt in foods is a very cheap, low-cost preservative. So it just helps keep the foods stay on the shelf longer. But unfortunately, these types of foods can be harmful to you and raise your blood pressure. And some people are even what we call salt sensitive. So one person might eat a certain amount of salt, and then another person eats the same amount of salt, and the other person's blood pressure might go up. So each person responds to salt differently. And how do you reduce your salt intake? Mostly, cooking at home is best, if you can possibly cook at home. And then looking on labels, if you purchase foods, they all have a label on them. And if you can, aim for foods that have less than 10% of your daily intake of salt. Ideally 5, but I tell my patients, because it's very hard to find 5% or less, but to aim for at least 10% or less. There's lots of low sodium versions of different things, and I would look for those in addition. But it's a lot of hidden salt. Dr. Garg mentioned the silent killer. Well, I think salt, unfortunately, is secretly hidden in a lot of our food. So we do have to keep an eye out for it, especially when we're shopping.
Right. So salt is one thing which needs to be taken care of. What other things are there which we should keep in mind to keep our blood pressure under control?
Great. So it's really trying to consume an overall healthy diet or eat an overall healthy diet. So a lot of plant proteins like dal is very good for your blood pressure. Foods that have high potassium levels, and this is if you don't have any kidney problems. Those are like tomatoes, potatoes, beans, those kinds of things are also very good for your blood pressure. Drinking low fat milk is good for your blood pressure. And then, as I mentioned earlier, even having beets, plenty of beets in your diet, also, and walnuts, for example, hibiscus tea, also can lower your blood pressure. So there's actually a lot you can do to lower your blood pressure. I know that a lot of people are on medications for their blood pressure. In fact, that's blood pressure problems are the most common reason for a prescription and a doctor's visit. But actually, all of these things that I've told you, they actually reduce your blood pressure the same as a blood pressure pill. So to the same extent. So exercising, weight loss, each of those is very similar to either a half a pill of blood pressure or a whole blood pressure medication. So by just simply doing several of these things that you like to do, you can actually reduce your blood pressure or reduce the medications you're on for blood pressure treatment.
Right. And as far as the quantity of food is concerned, can you tell a little bit about this? Because what happens is, especially now sitting at home all the time, whenever you are moving around, you are in front of the fridge or you are in front of your pantry, you just take out something and start munching. How does that also impact the blood pressure?
So increasing your weight, and the thing is for South Asians, we studied South Asians in BC. So the listeners here, and we found that South Asians living in BC had much higher blood pressure than any other ethnic group living in BC. And that probably is in part due to diet. And it's not really necessarily the South Asian diet, but it can just be the quantity of that we're eating. And I think a lot of us are guilty of what we call mindless eating. And mindless eating is when you're not even eating for hunger, you're just eating out of habit. So a classic example is after you've finished a hard day of work and you've finished eating dinner, then later on in the evening, you're just sitting around, maybe talking to your family or watching TV or watching a program, you just start munching. And this is more than just being hungry. This is actually just wanting and feeling like it's just actually a habit. Your brain learns that even after you've eaten dinner, if you sit on the couch and you're relaxed, you like to pair that with munching on something. So it's just a habit that we form, and it's really trying to realize that those are just habits. So an idea, especially in the evening, is to pre-plan what your snacks will be. So when you're thinking about your evening, what kind of snacks do you want to eat? Some vegetable in your snacks, the cucumber, anything like that. Some protein, maybe nuts that you like, and even small pieces of dark chocolate will be helpful for you. So pre-plan your snacks, and I think that's evening time is where most of us start doing this mindless eating. So it's good to be proactive about it.
Right. Dr. Garg, your favorite
Yeah.
time to
Well,
talk
I
about
think
how and when to eat.
Dr. Khan is really reaffirming what we've been talking about. क्या खाते हो, कैसे खाते हो, क्यों खाते हो, कब खाते हो, कितना खाते हो.
Right.
And I would say for our viewers, we should take great pride. The diet which every South Asian eats is very good. Place where we fall apart is कब खाते हो, कितना खाते हो, क्यों खाते हो, कैसे खाते हो. And mindfulness of eating is क्यों खाते हो. We need to be aware of it.
Right.
And I think all those changes, I could assure all our viewers, will give you healthy living. So I think our message again today is that diet plays a role. But I think I'd like to hear from Dr. Khan one aspect, and that is why our people have high blood pressure. As a medical biochemist, I've done a fair amount of work in this area. As a matter of fact, I have the largest series of diagnostics in this. The sensitivity to salt. As you age, your vessels become more sensitive to salt. And majority of high blood pressure in South Asian is due to high volume, high sodium sensitivity.
Right.
And again, that is whether it's genetic or whether it's epigenetics, that's not that important. The important thing is that so-called essential hypertension, hypertension for which we don't know the cause, is related to this, and salt plays a huge role. So, Dr. Khan, you and I have talked before. I think watching salt labeling and watching salt in the label became quite important, and added salt, especially in home cooking. So maybe you could share a little bit of your prescription, so to speak, for our viewers. Because I think
Absolutely.
that's the message.
Very true. Dr. Nadia, it's time for a break, so I'll have to interrupt you here. I'll have this question answered from you once we are back from this break. And along with that, you have a lot of questions which are coming from our viewers. So we would like to ask those questions also, and we'll be shortly back.
ਭਾਰਤ ਪੈਸੇ ਭੇਜਣੇ ਹੋਣ ਜਾਂ ਫਿਰ ਮੰਗਵਾਉਣੇ ਹੋਣ ਤੇ ਯਾਦ ਰੱਖੋ ਪੰਜਾਬ ਫੋਰੈਕਸ ਨੂੰ ਤਸੱਲੀ ਬਖਸ਼ ਸੇਵਾਵਾਂ ਅਤੇ ਵਧੀਆ ਰੇਟ ਦੇਣ ਦੀ ਇਹ ਗਾਰੰਟੀ ਕਰਦੇ ਹਨ। ਅੱਜ ਹੀ ਕਾਲ ਕਰੋ 6043491313 ਉੱਤੇ।
ਲੈਣਾ ਚਾਹੁੰਦੇ ਹੋ ਨਵੇਂ ਤੇ ਵਧੀਆ ਅਪਲਾਈਐਂਸਸ ਜਿਵੇਂ ਕਿ ਸਟੋਵ, ਅਵਨ, ਫ੍ਰਿਜ, ਵਾਸ਼ਰ ਡਰਾਇਰ, ਮਾਈਕ੍ਰੋਵੇਵ, ਫ੍ਰੀਜ਼ਰਸ ਜਾਂ ਡਿਸ਼ਵਾਸ਼ਰ, ਤਾਂ ਫਿਰ ਪਹੁੰਚੋ ਪ੍ਰੀਮੀਅਮ ਅਪਲਾਈਐਂਸਸ ਤੇ। ਇਹਨਾਂ ਦੀਆਂ 3 ਬ੍ਰਾਂਚਸ ਸਰੀ, ਐਬਟਸਫੋਰਡ ਤੇ ਚਿਲਵੈਕ ਵਿੱਚ ਹਨ। ਇੱਥੇ ਤੁਹਾਨੂੰ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਅਪਲਾਈਐਂਸਸ ਮਿਲਣਗੇ। ਇਹ ਡਿਲੀਵਰੀ ਤੇ ਇੰਸਟਾਲੇਸ਼ਨ ਵੀ ਕਰਦੇ ਹਨ। ਸਪੈਸ਼ਲ ਪੈਕੇजेस ਫॉर ਬਿਲਡਰਸ ਐਂਡ ਹੋਮ ਓਨਰਸ। ਕਾਲ 6045904140 604 590 4140। ਸ਼ਾਈਨ ਫੈਮਿਲੀ ਡੈਂਟਲ ਕਲੀਨਿਕ ਡਾਕਟਰ ਸਤਪ੍ਰੀਤ ਸਿੰਘ ਦੀ ਦੇਖਰੇਖ ਹੇਠ ਆਧੁਨਿਕ ਮਸ਼ੀਨਾਂ ਦੀ ਵਰਤੋਂ ਨਾਲ ਤੁਹਾਡੇ ਦੰਦਾਂ ਦੀ ਸਹੀ ਕੇਅਰ ਕਰਦੇ ਹਨ। ਇਹਨਾਂ ਦੀ ਸੇਵਾਵਾਂ ਵਿੱਚ ਦੰਦਾਂ ਨੂੰ ਸਾਫ਼ ਕਰਨਾ, ਕਰਾਊਨਸ, ਬ੍ਰਿਜਸ, ਡੈਂਟਲ ਇੰਪਲਾਂਟਸ, ਰੂਟ ਕਨਾਲ, ਡੈਂਚਰਸ, ਬੌਂਡਿੰਗ ਅਤੇ ਵਨੀਰਸ, ਐਕਸਟ੍ਰੈਕਸ਼ਨਸ, ਬੋਨ ਗ੍ਰੈਫਟਿੰਗ ਆਦਿ ਸ਼ਾਮਲ ਹਨ। ਬੱਚਿਆਂ ਦੀ ਡੈਂਟਿਸਟਰੀ ਦੇ ਵੀ ਮਾਹਰ ਹਨ। ਇਹ ਇੰਸ਼ੋਰੈਂਸ ਕੰਪਨੀਆਂ ਨੂੰ ਡਾਇਰੈਕਟਲੀ ਬਿੱਲ ਭੇਜਦੇ ਹਨ ਤੇ ਤੁਹਾਨੂੰ ਘੱਟ ਤੋਂ ਘੱਟ ਚਾਰਜ ਕਰਨ ਦਾ ਵਾਅਦਾ ਕਰਦੇ ਹਨ। ਫॉर ਸਪੈਸ਼ਲ ਸ਼ਾਈਨ ਐਂਡ ਸਮਾਈਲ 604 503 03 20 ਤੇ ਕਾਲ ਕਰੋ। ਕਿੰਗ ਜਾਰਜ ਸੁਪਰ ਸਟੋਰ ਦੇ ਕੋਲ, ਯੂਨਿਟ 370, 7488 ਕਿੰਗ ਜਾਰਜ ਬੁਲੇਵਾਰਡ, ਸਰੀ। It's a matter of great honor that Dr. Nadia Khan and Dr. Arun Garg are our guests today, and we are talking about high blood pressure, the causes, and of course, the focus is on prevention. And along with that, how integrative health approach can be used in our daily lives so that we can save ourselves from high blood pressure. So let's get back our guests and continue with the discussion. So Dr. Nadia, before the break, Dr. Garg asked you about, he focused on the South Asian community as such, and as you deal with them, could you answer that question?
Sure. So there's a few things Dr. Garg was asking about. Why do South Asians have such high blood pressure? Why are they getting high blood pressure faster than any other rate, than any other ethnic group here in British Columbia? And certainly part of that may be due to salt, and there's probably a lot of issues that we still need to sort out. But some of it actually even starts from the time we're born. So we found that South Asians, for example, had lower birth weights, but soon after they're born, there was a strong desire to make children or babies as chubby as possible. So that rapid weight gain even was associated with high blood pressure. There's some evidence to suggest that we lack vitamin D, and that might also, and most vitamin D comes from either milk or the sun, for example. And so that might also cause high blood pressure. And the other thing is South Asians living in Canada uh, do not do very much physical activity. So it's physical activity really means the activity outside, like above what you're doing at home. So even if you're cooking and going upstairs, downstairs, and doing all of your household activity, going grocery shopping, that's not really considered the same thing. So you want to do activity above that or beyond that amount. So at least 30 to 50 minutes of exercise. And that typically is a brisk walking. And when we say brisk walking, that's walking fast enough so you can talk, but you probably couldn't sing a song. So that's really what we mean by brisk walking. So when you're thinking about your diet, the salt, which is certainly one of the factors for the South Asian community, again, it's looking at food labels. And if you're cooking from home, you want to try to have less than 1 teaspoon of salt in your entire day's worth of cooking. And the thing about if you're used to a high salt diet, lowering your salt takes a little bit of time to get, and patience to get used to it. So the first few weeks, maybe even a month, you won't be used to it. Maybe food will taste more bland. But after about a few weeks or a month, you will suddenly, your taste level will change, and you'll find that you're very much used to the lower salt diet. And if someone gives you a regular or high salt diet, you'll feel it's too salty and you won't enjoy it. So it just does take a little bit of time to break that cycle, but it definitely can be broken. And a lot of my patients feel the same way. Just after a few weeks, they got used to it and then they're fine.
Right. Okay. Dr. Garg would like to take some questions. The first question is from Raj Banga from Nanaimo, and he says the milk consumption and use of desi ghee is quite high in our homes. How much impact does that have on high blood pressure?
Well, the ghee is it's very difficult to say, but the high fat milk, like whole milk, has been associated with higher blood pressure as a part of a whole diet. So there is a diet called the DASH diet. That's a diet to stop hypertension diet. And they emphasize low fat milk, and that's been associated with lower blood pressure. So I think you can drink milk, but to reduce the fat content.
Right. My next question is from Gurpreet Kaur of Surrey, and she says that we have replaced the normal salt that we use at home with the Himalayan pink salt. Is it good? Is consumption of Himalayan pink salt good for us?
Well, it's really the sodium, so it's still sodium. So some of the no salt substitutes are better than those. Potassium-based substitutes are better.
Yeah, RPG, just to re-emphasize that point, because that has come up many times. Some salt is better than others. No. Salt is a salt is a salt. And I think whether it's a salt from Himalayas, whether it's salt from sea, whether it's salt from special mines, no, it doesn't work that way. And I think no added salt, just like no added sugar, is really where we should be heading for.
Right. Okay. Dr. Nadia, the next question is from Amrik Singh from Sydney, Australia, and he says, asking you that what impact does high blood pressure has on the body? You know, you talked about the heart pumping, you talked about the heart, but otherwise, what all problems or diseases can arise from high blood pressure?
Great question. So the thing is that high blood pressure is a problem with the blood vessels, and you can see that the blood vessels go to every single organ in the body. So there can be damage to every single organ in the body. We know about heart attacks and we know about strokes. In fact, 2/3 of all strokes, and most of strokes, are caused by high blood pressure. When Canada started reducing their blood pressure, we saw stroke rates just drop significantly. So it makes a huge impact. The other thing that we're finding out is that high blood pressure is associated with dementia and loss of memory. And we know that getting good control of your blood pressure helps keep your memory longer. Things like kidney disease, blindness, amputations, those are all linked to high blood pressure. And that's why it's the number one killer, number one or leading cause of death and disability around the world.
I have next question for Dr. Garg. Dr. Garg, the question is from Ram Dhunna from Victoria, and he's asking you, as Dr. Nadia also mentioned about yoga. You know, there are different forms of yoga now which are being commercialized yoga, actually, which are available. So you always talk about yoga, which is to be, it helps us. So can you please elaborate on what kind of
Yeah,
yoga should
absolutely.
be used at home?
Thank you. Thank you for asking that question, because it's not yoga, but it's really yogic philosophy.
Right.
Yoga is really summation of so many things. Exercise, asanas, is a very small part of it. So the point about yoga is asanas are important, but the 8 limbs of Patanjali, which includes lifestyle, which includes meditation, but most important is breathing. And as far as types of yogas are concerned, there is only one type of yoga. There have been many, many proponents, and people give their name to that this becomes yoga. That's not yoga is. Yoga really is the 8 limbs of yogic philosophy as prescribed by Rishi Patanjali 500 BC, and that hasn't changed. And the most important part of yoga is breathing, and that has such a huge impact on blood pressure. And by through breathing, proper breathing, you could make a huge difference. So I think I would say yogic philosophy and practice is what we're really talking about, and
Right.
breathing part and some of the asanas. And you don't have to be torturing your body into big asanas. As a matter of fact, I don't even say that we should be doing those. Very light asanas. International Day of Yoga is coming, and that protocol is ideal. They have worked very hard to standardize it and is making it very simple. Within an hour, you can get all the breathings and you could get all the exercise. And most important is meditative mindfulness. It
Right.
becomes very important. So it's a package.
Great. Dr. Nadia, very interesting question from Rajbant Singh from Toronto. And as you mentioned about alcohol intake, he says that even doctors recommend one drink a day, and wine is good for heart. What would you say? What should a person keep in mind while consuming alcohol?
So I think, we used to have this based on this study, old studies in France that showed that people who drank at least one glass of wine per day, they tended to live longer, had less heart disease and stroke. But there have been more recent studies compiling thousands of patients all over the world, and they found that there's no safe limit or healthy limit of alcohol. So even one drink is worse than zero, but the risk really starts to rise once people consume 2 or more than 2 drinks
Right.
per day.
Okay.
So that is a surprise to a lot of people. So we usually recommend, if you are a drinker, try to keep with 2 or less drinks per day, and not binge drinking on the weekend either. But if you don't drink alcohol, don't start, because even one drink does have an increased risk.
Great. Thank you. Again, time for a short break. And in the last segment, we will continue with the questions and also with some expert wisdom from both of you. So we'll be shortly back.
ਘਰ ਇੱਕ ਐਸੀ ਥਾਂ ਹੁੰਦੀ ਹੈ ਜਿੱਥੇ ਹਰ ਕੋਈ ਆਪਣੀ ਨਿੱਜੀ ਜ਼ਿੰਦਗੀ ਦੇ ਸੁਨਹਿਰੀ ਪਲ ਯਾਦ ਰੱਖਦਾ ਹੈ। ਉਹ ਜਗ੍ਹਾ ਜਿੱਥੇ ਉਹ ਰਹਿੰਦਾ ਹੈ ਤੇ ਪਿਆਰ ਭਰਿਆ ਜੀਵਨ ਬਤੀਤ ਕਰਦਾ ਹੈ। ਇਹ ਗੱਲਾਂ ਤਾਂ ਹੀ ਪੂਰੀਆਂ ਹੁੰਦੀਆਂ ਨੇ ਜਦ ਕਿਸੇ ਜਗ੍ਹਾ ਨੂੰ ਸਜੇ ਹੋਏ ਘਰ 'ਚ ਬਦਲਿਆ ਜਾਵੇ। ਨਵੇਂ ਘਰਾਂ ਨੂੰ ਫਰੇਮਿੰਗ ਤੋਂ ਲੈ ਕੇ ਫਿਨਿਸ਼ਿੰਗ ਤੱਕ, ਡ੍ਰੇਪਰੀ, ਪੇਂਟਿੰਗਸ ਤੋਂ ਲੈ ਕੇ ਡੈਕੋਰੇਸ਼ਨ ਅਸੈਸਰੀਜ਼ ਤੱਕ, ਤੁਸੀਂ SK ਹੋਮ ਡਿਜ਼ਾਈਨਸ ਦੀਆਂ ਪ੍ਰੋਫੈਸ਼ਨਲ ਸਰਵਿਸਿਜ਼ ਲੈ ਕੇ ਆਪਣੇ ਸੁਪਨਿਆਂ ਦੇ ਘਰ ਨੂੰ ਹਕੀਕਤ 'ਚ ਬਦਲ ਸਕਦੇ ਹੋ। ਕੰਟੈਕਟ ਕਰੋ ਸੰਦੀਪ ਕੌਰ 6048259295।
ਵੈਨ ਕਾਸਾ ਟਾਈਲ ਅਤੇ ਸਟੋਨ ਸ਼ੋਰੂਮ ਇੱਕ ਐਸੀ ਥਾਂ ਹੈ ਜਿੱਥੇ ਤੁਹਾਨੂੰ ਹੋਲਸੇਲ ਕੀਮਤਾਂ ਤੇ ਹਰ ਕਿਸਮ ਦੀਆਂ ਟਾਈਲਸ, ਸਟੋਨ, ਮਾਰਬਲ, ਬੈਕਸਪਲੈਸ਼, ਮੋਜ਼ੇਕ ਆਦਿ ਵਾਜਬ ਕੀਮਤਾਂ ਤੇ ਮਿਲ ਸਕਦਾ ਹੈ। ਇਟਾਲੀਅਨ, ਸਪੈਨਿਸ਼, ਚਾਈਨੀਜ਼ ਪੋਰਸਲਨ ਜਾਂ ਸਿਰੈਮਿਕ ਟਾਈਲਸ ਜਾਂ ਮਾਰਬਲ ਸਪੈਸ਼ਲ ਆਰਡਰ ਤੇ ਜਾਂ ਕਲੀਅਰੈਂਸ ਤੇ ਲੈ ਸਕਦੇ ਹੋ। ਮਾਲਕ ਡਾਇਰੈਕਟ ਟਾਈਲਸ ਇੰਪੋਰਟ ਕਰਦੇ ਹਨ, ਜਿਸ ਕਰਕੇ ਵਧੀਆ ਕੁਆਲਿਟੀ ਦਾ ਸਮਾਨ ਤੁਸੀਂ ਆਪਣੇ ਘਰ ਦਾ ਸ਼ਿੰਗਾਰ ਬਣਾ ਸਕਦੇ ਹੋ। ਅੱਜ ਹੀ ਵਿਜ਼ਿਟ ਕਰੋ 1304 to 84 ਐਵਨਿਊ ਸਰੀ ਪੰਜਾਬੀ ਹਿੰਦੀ ਵਿੱਚ ਗੱਲ ਕਰਨ ਲਈ ਕਾਲ ਕਰੋ 604 330 7363 604 330 7363। Once again, welcome back to the program. I have two special guests, Dr. Nadia Khan and Dr. Arun Garg with me, and we'll be getting them back shortly. But before that, our sponsor for today's program. This program is being brought to you with the support of Day-to-Day Wholesale Cash and Carry. This is British Columbia's biggest South Asian grocery store where you can get groceries, party wear, kitchenware, homeware at wholesale prices. If you're looking for grocery from South Asia, that is India, Pakistan, Bangladesh or Sri Lanka, you can come over here. They have more than 5,000 products which are displayed. For best prices, unique grocery buying experience and high quality products, come to 7843 128th Street, Surrey. Phone number is 604-503-8787. ਸਾਡੇ ਨੈਕਸਟ ਸਪਾਂਸਰ ਹਨ ਜੀ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ। ਘਰ ਦੀ ਸ਼ਾਨ ਹੁੰਦੀ ਹੈ ਕਿਚਨ ਤੇ ਇਸ ਨੂੰ ਸੋਹਣਾ ਬਣਾਉਣ ਵਿੱਚ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਲੋਅਰ ਮੇਨਲੈਂਡ ਦੀ ਇੱਕ ਜਾਣੀ ਪਛਾਣੀ ਕੰਪਨੀ ਹਨ। ਕਸਟਮ ਹਾਈ ਐਂਡ ਘਰਾਂ ਤੋਂ ਲੈ ਕੇ ਮਲਟੀ ਯੂਨਿਟ ਪ੍ਰੋਜੈਕਟਸ ਇਹ ਕਰਦੇ ਨੇ। ਹਰ ਤਰ੍ਹਾਂ ਦਾ ਸਪੈਸ਼ਲ ਕੈਬਨਿਟ ਦਾ ਕੰਮ ਕਰਾਉਣ ਲਈ ਬੈਸਟ ਹੋਮ ਕਿਚਨ ਕੈਬਨਿਟਸ ਨੂੰ ਯਾਦ ਰੱਖੋ। ਕਾਲ ਕਰੋ ਸੁਰਜੀਤ ਤੇਜ਼ੀ 604-591-8171 604 591 8171। Once again, both our guests are back and we have a lot of questions. One important question which has been brought forward by is Satnam Kaur from Surrey, and she's saying that consumption of marijuana, especially by the children, and drugs is on the rise. How serious this consumption can impact a youth?
So, there's certain drugs like amphetamines, for example, that raise blood pressure very sharply and to a very extremely high extent very quickly after consumption of things like amphetamine or speed, and that can cause things like a stroke or a heart attack very soon. The data on marijuana is less clear. There are some studies that suggest marijuana might raise blood pressure, but others that do not show that. So I think the impact of drug use is more on their overall well-being, other conditions, risk of overdose, those kinds of issues. But there are some that specifically make your blood pressure worse.
Right. Dr. Garg, would you like to add anything?
Well, I think the whole issue of drugs and how it impacts is very controversial. And I think we'll be remiss in not saying to our viewers and listeners, be careful.
Right.
This, and I think addiction which results from that, and alcohol we talked about. The alcohol addiction is a huge problem,
Right.
and drug addiction. So cannabis, though, is an important addition in the overall scheme of things. My own advice will be everything in balance. And that's the essence of the philosophy we are talking about. And I think one thing, if I may say, Dr. Khan introduced the blood pressure. Blood pressure is an example of the best example of integrative medicine. Every organ in the body is affected.
Right.
So it's not just the heart, not just the heart specialist, not just the liver specialist, not just the GI specialist, not the brain specialist. Dr. Khan had the Journal of Internal Medicine, that means the whole body.
Right.
And the last thing I just want to say is that we both are representing University of British Columbia, Faculty of Medicine, and we are very proud affiliation, and we are very proud to be bringing this through this University of British Columbia work.
Right. Dr. Nadia, my next question is from Manjeet Singh of Vancouver, and he's asking the connection between high blood pressure and high cholesterol. And on cholesterol also, he's asking that we have been hearing that cholesterol is not a major issue. So he wants to give a personal example, and he says that he is just asking you that he's giving a reference as to he got his blood tested, everything was fine, but only the high cholesterol was there. But he also has sometimes high blood pressure. So what is the connection between high blood pressure and high cholesterol?
Two conditions tend to happen at the same time or coexist. We call them clustering conditions.
Right.
And part of it is because the same reasons that cause high cholesterol cause high blood pressure, like genetics, like weight gain, those kinds of things also drive up both conditions simultaneously. Both, even though I've been saying hypertension is the leading cause of heart disease, cholesterol problems also contribute to heart disease. And so paying attention to your cholesterol and your blood pressure is very important. And again, I think this is about the holistic approach.
Right.
You can't just treat one and ignore the other. By the time someone's had a heart attack or a stroke, even if they've had high blood pressure, many things in the body, many systems are already affected. The kidneys, the blood vessels, the heart. There are lots of systems that are already impaired by the time people have high blood pressure and high cholesterol. And the risk factors for heart disease and stroke are caused by several key leading things, but cholesterol is a big problem in the South Asian community, as is high blood pressure, and both need to be treated with lifestyle and, if needed, medication.
Right. Ladies and gentlemen, there are some personal questions which you are sending to me. I would regret that I will not be able to ask you those questions because we are talking in general terms. And if in general terms, if you have any question, please forward me that, and I would love to get that answer from our guest. Another question is from Ramanjeet Singh, and he's saying, as far as you're talking about cholesterol, so what can be done to control high cholesterol? What precautions should be taken? Is salt consumption one thing which you have already mentioned to control that, or there are some other things also?
There are some other things that you can do to try to reduce your cholesterol, and one is trying to avoid simple sugars. Helps, and as well as saturated fats. So looking for more unsaturated fats, that's like cooking with canola oil or olive oil is better than other, for example, forms of oil. So those are just some examples of how you can reduce your saturated fat content in your diet. And then also, one key thing that helps control your cholesterol is also your activity level. So if you are actually what we call a couch potato, you typically sit on the couch a lot. When you exercise or when you go for a walk, you will get the best reductions in blood pressure and cholesterol. When people that are very fit, they're always exercising. When they increase their exercise, it doesn't seem to make a difference. But to go from being a couch potato to someone that goes for walks makes a big difference. So all of those people that think that it won't make a difference, it can make a huge difference, especially in those people.
Great. There are many more questions, but time will not permit me. I think we are focused on quarter questions. So, Dr. Nadia, the integrative health approach, this is coming further in a big way. It's being used at a lot of places. What is your observation in the medical fraternity? Is this a thing which is talked about much in Canada? And in the coming years or months, will we find more of these kind of efforts so that the mind, body, soul concept is adopted in these places?
Yeah, so I think that it's a growing field, and there's growing recognition about how important issues like your stress level, your thinking, your meditation, all of these things, deep breathing exercises, how they can impact blood pressure and other health conditions. We did a national survey across the country, and we asked Canadians, what do they want to know about for blood pressure? And by far, they wanted to know about the different lifestyle factors, what they could do to reduce stress. They really are already there, and I think the medical system is going to catch up. And interestingly, we did speak with the NHS in the UK to share our results with them as well as in Canada. And people are very interested in trying to pursue this. So I think it's a growing field, and we'll see more.
Right. Dr. Garg, in conclusion, what would you like to
Yeah,
add?
I think we are absolutely right. What I call internal interventions versus external interventions. And internal interventions is how you see yourself, how you relate to yourself, how that affects your health. And I think as we understand pathophysiology better, as we understand biochemistry better, the science and evidence will take over. And I think Harpreet looks like there is a lot of interest on diet. So we
Right.
will do a special show, and we bring an expert because we have a very good understanding of food thy medicine, medicine thy food. And I think the questions which came could be of, we will try to answer and raise the awareness on it. I think it's
Right.
an important piece of information.
Absolutely. And Dr. Nadia Khan, in conclusion, any other pearl of wisdom which you would like to share from your experience working with the entire community, but especially focusing on the South Asians? Anything in end? What would you like to say?
So, all of these treatments that we talked about, lifestyle, medication, they can make a big impact and reduce the risk of stroke and heart
Right.
disease and make it live longer. The key is combining some of the medical treatments, like medications, with these lifestyle factors. And together that can make a significant impact. We know that South Asians tend to not take their medications regularly, and this is considered one of the main reasons why we still have a high risk of heart disease and stroke is from lack of taking the medication. So if the medications aren't suiting you, it's just to speak to your family doctor about it. They can switch you to something else. There's lots of different treatments available that you can tolerate, and along with health behavior change and lifestyle factors, can really get this under control. Very, very easy to treat
Right.
and control.
Wonderful. Dr. Nadia Khan and Dr. Arun Garg, it was a pleasure having both of you on the show. Thank you very much for all this information, and we hope our viewers have learned a lot from what you said today, and they'll try to imbibe those things in their daily lifestyle, and they bring about the desired change that they want in their life. Thank you very much once again.
Thank you so much.
Thank you. Thank you
Dr.
for
Garg and
having
Dr.
us.
Nadia. Thank you.
Bye-bye.
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 So, ਅੱਜ ਦਾ ਪ੍ਰੋਗਰਾਮ ਕਰਦੇ ਜੀ ਇੱਥੇ ਹੀ ਸਮਾਪਤ। ਤੁਹਾਡਾ ਮੇਰਾ ਸਾਥ ਹੋਇਆ ਕਰਦਾ ਹੈ। We meet every Monday to Friday 7 p.m. Pacific Standard Time, and if you also want to be a part of this program, you can contact me at 604-603-7555, or you can email me at harpreetsingshow@gmail.com. The idea of this program is to educate you, inspire you, and to empower you. So if you yourself or if you know someone who can be an asset to others, please do contact me. ਇੱਥੇ ਹੀ ਕਰਨਾ ਪ੍ਰੋਗਰਾਮ ਦੀ ਸਮਾਪਤੀ। ਫਿਰ ਮੁਲਾਕਾਤ ਕਰਾਂਗੇ। ਹੈਵ ਅ ਸੇਫ ਈਵਨਿੰਗ, ਸਟੇ ਹੈਲਦੀ ਐਂਡ ਇੰਜੋਏ ਯੋਰਸੈਲਫ। ਛੋਟੇ ਘਰਾਂ ਤੋਂ ਲੈ ਕੇ ਵੱਡੇ ਪ੍ਰੋਜੈਕਟਸ ਤੱਕ ਬਾਹਰੋਂ ਸ਼ਿੰਗਾਰਨ ਲਈ ਮਸ਼ਹੂਰ ਹਨ ਜੇਰੇ ਸਟੋਨ ਕੰਪਨੀ ਵਾਲੇ। ਘਰ ਨੂੰ ਟ੍ਰੈਡੀਸ਼ਨਲ ਕੰਟੈਂਪਰੇਰੀ ਜਾਰਜੀਅਨ ਮਾਡਰਨ ਲੁੱਕ ਦੇਣੀ ਹੈ ਤਾਂ ਕਾਲ ਕਰੋ ਜੇਰੇ ਸਟੋਨ ਨੂੰ, ਜੋ ਆਪਣੇ ਕਾਬਲ ਸਟਾਫ ਨੂੰ ਭੇਜ ਕੇ ਫ੍ਰੀ ਐਸਟੀਮੇਟ ਦੇਣਗੇ। ਸਟੋਨ ਟਾਈਲਸ, ਅਰਬਨ ਸਟੋਨ, ਮੋਲਡਿੰਗਸ, ਐਕਸੈਸਰੀਜ਼, ਪਿਲਰਸ ਆਦਿ ਨੂੰ ਇੰਸਟਾਲ ਕਰਨ ਵਿੱਚ ਇਹ ਮਹਾਰਤ ਰੱਖਦੇ ਹਨ। 25 ਸਾਲ ਦੀ ਵਾਰੰਟੀ, ਮੇਨਟੇਨੈਂਸ ਫ੍ਰੀ, ਗਵਰਨਮੈਂਟ ਅਪਰੂਵਡ ਟਾਈਲਸ ਦੀ ਵਰਤੋਂ ਕਰਕੇ ਜ਼ਰੂਰ ਵੇਖੋ। ਕਾਲ ਕਰੋ 604-614-9231 ਜਾਂ ਫਿਰ ਵਿਜ਼ਿਟ ਕਰੋ ਯੂਨਿਟ ਨੰਬਰ 500, 1515 ਬ੍ਰੌਡਵੇ ਸਟਰੀਟ, ਪੋਰਟ ਕੁਕਟਲਮ।